Ever wondered about the mysteries that lie in the realm of rare diseases? What if we unraveled the enigma of Erdheim-Chester disease today? Erdheim-Chester disease, or ECD for short, is an extremely rare disorder falling under the umbrella of non-Langerhans cell histiocytosis. To put it simply, ECD is characterized by the abnormal multiplication of a certain type of white blood cell, histiocytes. These histiocytes, instead of behaving as they should, start to multiply and accumulate in various tissues and organs throughout the body, causing inflammation, tissue damage, and the formation of lesions. Now, you might be wondering, what does this look like symptom-wise? Well, the symptoms can vary widely and largely depend on the organs affected. Some individuals might experience bone pain, particularly in the long bones of the legs. Others might encounter fatigue, fever, weight loss, and even neurological symptoms if the disease involves the central nervous system. ECD is not selective about the organs it affects. It can impact multiple organ systems, including the bones, skin, cardiovascular system, central nervous system, lungs, kidneys, and more. It often manifests as bone lesions, but it can also involve soft tissues and vital organs. Diagnosing Erdheim-Chester disease is no easy task. Its rarity and the nonspecific nature of its symptoms present a real challenge. Diagnosis typically requires a combination of clinical evaluation, imaging studies like X-rays, CT scans and MRI, biopsy of affected tissues, and genetic testing. So, what about treatment? Unfortunately, there's no cure for Erdheim-Chester disease. The aim of treatment is to alleviate symptoms, slow disease progression, and improve quality of life. This may involve systemic corticosteroids, targeted therapies like inhibitors of BRAF mutations, chemotherapy, immunotherapy, and supportive care for organ-specific complications. The prognosis for Erdheim-Chester disease can vary. It largely depends on the extent of organ involvement and the patient's response to treatment. Some patients may have a relatively slow disease progression with periods of stability, while others may experience progressive disease and complications that can be life-threatening. It's crucial to note that due to its rarity, Erdheim-Chester disease remains somewhat of an enigma. Ongoing research efforts strive to better understand its underlying mechanisms, improve diagnostic techniques, and develop more effective treatments. Increasing awareness among healthcare providers and the general public is also paramount for early detection and management of the disease. In summary, Erdheim-Chester disease is a complex and challenging condition that necessitates a multidisciplinary approach for optimal management and care of affected individuals. The journey to fully understanding and effectively treating ECD is ongoing, reminding us of the incredible complexity and wonder of the human body.